So yeah, so far we've been talking about basically it's to be able to analyze stakeholders. So we've talked um, about stakeholders, what type of stakeholders there are out there in the healthcare system, what are the barriers, and we talked about what change, if we want to bring about a change, how would that change have different barriers? We talked a bit about it in the previous session also. So now we will discuss more in detail about the pros and cons of some other aspects of stakeholders and of bringing about change. So we were on slide 30. Just let me scroll down. Okay, so in this part of the presentation, we are talking about evaluation of the effectiveness of quality systems. So there are different aspects that you would want to evaluate their effectiveness. So their quality systems, what they are, what their strengths and weaknesses are. We'll talk about them. We'll talk about policies. So you're introducing or you're evaluating the effectiveness of policies and procedures. So it's very evident that if you have quality systems, it's going to be it's going to be a framework or a yardstick. So whenever you're going down in quality or wherever you are in terms of your quality, it gives you a framework for maintaining that high quality and improving your service on a continuous basis. They'll incorporate standards and best practices, obviously, for quality, and they'll ensure that compliance is there with regulations. You'll have regular audits and when you have quality systems, but the weakness is that it's time consuming research, it takes a lot of resources, and it might be bureaucratic sometimes if it's not properly streamlined, and it depends upon the implementation. How much are you implementing it and how much is it aligned with your own organizational goals? Policies and procedures, you're introducing policies and procedures. They're obviously their behaviors and processes that promote consistency and accountability. Policies are basically there to give you a framework again. They're valuable, obviously. The staff, they know them, they're there to guide the staff, and they can, your various risks could be reduced because of them. The weakness is that sometimes they're outdated or not properly communicated, and these can hinder effectiveness. So sometimes you might not know that, or all the staff might not be aware of the policies that are out there. So that becomes a problem then, the implementation. And sometimes they're very complex or restrictive policies, and that then has an impact on the work that you are doing or the change that you want to bring about. Monitoring and evaluation. So monitoring is on a regular basis, evaluation is at different intervals. You can have a midterm evaluation or the end of term evaluation of anything that you're doing, any procedure that you're doing. And this would enable you to track progress. So whatever concerns you have, whatever issues that are there that are occurring, and those are highlighted through monitoring and evaluation. However, it depends upon accuracy and relevance of the data that you're collecting. And if it's not conducted systematically, there's some things that may be overlooked. So the monitoring and evaluation has to be conducted regularly and systematically. Stakeholder involvement, for how much do you want to involve them? This includes the staff, the patients, families. So how much are you involving them? And this would lead to patient-centered care approach to care. So your patients are also obviously your stakeholders. Weaknesses is that it's hard to gather information from different stakeholders because they're of diverse natures. And it can be challenging and time consuming. And then there are conflicting interests also on regarding various stakeholders. Adaptability and flexibility, it's very important because things keep changing. Quality systems, if they're adaptable, to changing circumstances, they then have the best practice being more effective. And so decisions are being made, and if you have adaptability in your policies and procedures, it's always uh, considered good. But then you have to have a balance between how much flexible can you be. And sometimes there are rapid changes that are required, or rapid updates that are happening, and then you don't have the resources available. Communication and training has always been very helpful when you're communicating policies and procedures. You can give comprehensive training and ensure that staff that understand and implement the policies and procedures properly, they have them understood correctly. It gives the staff competence and confidence. However, if it's inadequate or inconsistent, the communication, there could be misunderstandings, non-compliance, and training efforts may not reach all staff, particularly in large organizations. Then patient-centeredness is very important. This obviously gives you how much are the patients satisfied. This gives them an involvement in decision making also. However, you again have to have a balance between how much are you keeping it patient-centered, how much are you giving them a chance to be a part of their healthcare, and how much are you in their best interest. So whatever happens, it should be in their best interest. So that has to be um, uh, put at the center, obviously, even when you're considering their opinions and their plans. Um, so it's very important to understand that there are some strengths as well as weaknesses in all these strategies. So, but they should be these barriers should be understood, be kept in mind, so that when you're implementing them, they're there to guide you, and you know you have an idea that they exist. So here we'll analyze the factors which influence the achievement of quality in health and social care. So there's leadership and governance. So effective leadership will always be strong. It's going to be visionary, and it's going to bring about effective changes in your organization. Effective governance is also very important. So this can influence your quality by setting standards, policies, and regulations. Resource funding. So by resources, we need adequate resources. When we're talking about staff, we're talking about facilities, obviously. Then there are budget constraints, which is a very big limitation, and obviously it's there always. It's never the case that you'll have more than your required budget, because it has to be allocated in a strategic way, and you have to learn how to work within the budget that's been allocated to you. Uh, yeah, and if you can't, obviously, then it becomes a constraint, and then you can't maintain the quality to the standards. Workforce training. So if you have competent staff, it's always going to be a win-win situation for you. And then you have adequate staffing levels. This is to prevent burnout, so that there's no overwork on anyone's plate. So, and then regulatory environment is very important. So there should be regulations within your organization, and people must adhere to them. Non-compliance will lead to quality issues, obviously. Accreditation and certification is very important on a regular basis. This gives the people who are not a part of the organization, this builds their trust. Patient-centeredness or service user-centeredness is very important. So you're involving them, obviously addressing their needs, and this contributes to care. They'll give you good feedback. This is what you require. Communication and empathy is very important. So whenever you're interacting with patients or anyone who's concerned with them, clinical guidelines, best practices. So we've talked about certain organizations that give us clinical guidelines. We must adhere to them. This gives us best practice, obviously. These clinical guidelines are obviously there to make the system more transparent, and when you adhere to these guidelines, obviously it's going to give you best results, because these guidelines are well researched and they've been proven through different trials. And quality improvement initiatives should always be a part of a culture that you should uh, keep within your organization. So anything that you're doing, just a bit about a bit of quality improvement brings tremendous changes in your outputs. Technology and information systems, this is without any doubt, these are the things that we need to be careful. We need to be incorporating this, because obviously because of human errors, um, things are going to be out of control and the quality is going to be impacted, which we do not need. So it has been found out that obviously if you have resource constraints, you have um, reduced staffing, or you have a staff that is not being able to perform effectively because of increased burden, which we've seen in the NHS. So if you've kept it as an electronic system, just a simple system as if you're entering a GP surgery, and you just have an electronic system of entering where the patient enters their data and lets the staff know that they're there for their appointment. Just these small electronic things, electronically enhanced things, can help you and the staff a lot in reducing errors and supporting evidence-based practice. Cybersecurity, these trainings should be given to the staff, obviously, because there could be breaches and cyber attacks. These happen, and these are a part of the system whenever you're adopting new technology and information systems. Patient safety and risk management is very important. You should have proper protocols and proper labeling everywhere. There should be safety protocols that are mentioned everywhere for people to be reminded of. And this is to prevent harm to patients. Adverse event management. So you should be aware that there could be any adverse event of any sort. But then if you're handling that adverse event, how are you handling it? This could be through root cause analysis, which we've talked about earlier. This could really help in understanding how that happened, how that event happened, and how could if it happens again, how could the chances of it reducing your quality of care of your service users, how could that be less impacted? Um, Cultural competency. So cultural sensitivity is very something that you need to understand. So health and social care providers, they should be culturally competent to serve. So are going to get a diverse set of populations. You should be aware of that, and you're going to accept that there are going to be cultural differences, and you're going to take care of them. This gives the patients more trust in you, and obviously you will be their first choice whenever they require treatment or support. Language access, again, always understand that there could be language barriers, and how would you address those language barriers? This will be obviously through the use of interpreters or through different ways of translating information. And then social determinants of health. So there are various social determinants of health. If you keep them in mind, you're going to understand that ill health is not only caused by bugs, it's not only caused by bacteria, viruses, or fungi, it's also caused by social um, attributes of the population or social circumstances. So obviously we've heard it, and we've seen in research that um, uh, low socioeconomic status or can impact your health. But then our main goal should be to reduce this disparity as much as possible. How do we do that? Obviously, we are going to be trained on that. And then if we know, obviously, what the social determinants of health are, we're then going to act upon them in our own capacity, obviously. And our major aim should be to reduce ill health amongst all. Ethical considerations. So you have your ethical frameworks. These include the principles include autonomy, beneficence, justice, non-maleficence, guiding decision making, and care delivery. So every person who's working within that system should be aware of these ethical frameworks. And end of life care. So you'll have these difficult situations where you'll have to probably go towards end of life support for someone. How do you cope with that, or how do you help families cope with that? That has to be taken under consideration, and everything has to be very ethical in those terms. Population health, public health initiative. So whenever you're talking about serious conditions, serious infections like COVID-19, you're always going to talk about people who are more vulnerable because of contracting those infections. So you have your vaccination programs, you have health education strategies. So if you're educating the population earlier on, it is a part of their system, then they know that this could happen, and immunization is the key to saving themselves, instead of having all those myths serve as a big barrier in between them and their vaccination or their health. And then epidemic preparedness. We've had a pandemic before. We've had pandemics in history. So we need to have. Obviously, we're never going to be prepared, but considering what the situation was, we will need to be prepared. Obviously, in terms of immunization, that only it becomes possible once the virus is there, or once that bug is there. But being prepared to have workforce that is that has proper research in those terms will help you in making decisions that should not require so much time. Data and quality metrics. These are very important. So you're collecting data which should be collected regularly, and you're analyzing these metrics so that any dip or rise in quality, any changes in whatever responses you have from the stakeholders, you should be aware of them, and you should record them properly. Benchmarking is very important. So you have your other institutes working around you. How do you work to the best of your ability, considering that you have different benchmarks to follow? Legal and ethical considerations. So if there's any medical malpractice that would impact the quality of the system, and this has to be dealt with, there should be a proper documentation and proper policy available as to how would you deal with such a situation. Informed consent is very important whenever you're taking under consideration. If you have your patients, you have your the people associated with your patients, there is always going to be an informed consent that you'll have to go through, and they'll have to go through it with you. Economic disparities, we've talked about these. Health insurance is very important. So people should be aware of the fact that they can be insured, and they should have the accessibility and affordability of care, and the amount that they need to spend, that should not be a barrier between themselves and the health that they require. These factors are very important, and they are all interconnected, and it is essential for organizations to understand these factors, uh, just because if they require quality improvement in all their processes and the procedures. Coming towards the last bits of the presentation. So here we're suggesting ways in which health and social care services could improve quality of service provision. So we've talked a bit about all of these, but I'll touch a bit more on them. So implementing a patient-centered approach is very important, in which you give individualized care plans. These give the service user or the patient more autonomy on their own situation, and this then helps them in a better understanding of what their situation is, and working with you towards improvement in their health. Shared decision making is very important. Talk about decisions, what they want to hear from you, what they want from you. Sometimes that might not be possible, but at times you could make them a part of their treatment plans, and they could be satisfied with whatever you have to treat them with. Communication, very important, should be effective. Whenever it happens,
You're
it should
breaking
be
up a
effective.
little bit.
Sorry.
It's okay. Sorry.
Yeah. Is it okay now?
Yes. Thank you.
Yeah. Thank you. So communication, so there should be active listening, very important when you're concerned with service users. You have clients, uh, listen to them. That's the first part in your whatever role you have, or in any role. You have to have that active listening, to actively listen to that person, and then display empathy. This is the way how you have an effective communication. You have trainings on effective communication. You need to have those continuous trainings, because people obviously sometimes there's some new forms of communication that are more effective um, uh, in terms of the resources that you have. So as I said, it's always better to go towards electronic systems compared to just relying on human-based efforts. So you have to have those proper communication skills that will help you in improving your quality and improving the quality of care, basically. Clear and accessible information. So if there's information, always make sure that it's very clear, it's succinct. People don't have to go through too much. So when you're writing reports, for instance, you're writing summaries, for instance, they should not require too much of jargons in them, or written, or if there's a public that you're referring to, or you're trying to communicate with the public, the general public, they would not consider a one-pager document so effective. But if you've got some just pictures on that one instead of that one document, and just something written in different languages, whichever languages you think are predominant over there, that could be more effective, and that could be more accessible in all cases. Again, preventive care, it's always better. Vaccination, screening, health education. So these are not considered very important, but you need to raise the awareness that they are very important, and they can save from various sorts of chronic diseases. Health promotion should be your initiative. This will empower individuals to adapt to healthy lifestyles, instead of like just simple messages like talking about. I was just reading this the other day, that the most important factor in treating depression or managing depression has been physical activity, actually. And the types of physical activity that they mentioned was yoga, and they talked about strength training activities. So these work even better than antidepressants. So obviously, you're not going to um, consider not taking antidepressants, but then you will have to have other strategies also in place. So just these simple messages that could just, out of 10, if you have just one or two people also changing their lifestyle, that could in a longer run lead to a bigger change. Yeah, that's what public health is about. And then quality improvement initiatives, that should be regular assessments on patient satisfaction, whatever you're doing. So patient satisfaction is very important, and you should not be um, afraid of it, to have a negative feedback, because that also helps you progress and understanding what problems that are existing there within your system. Those could be highlighted. Probably you are not seeing them through the lens of those patients. Evidence-based practice. So all your practices, whatever you're making, whatever decisions you're making, should always be evidence-based, which would then give you more transparency and give you better frameworks to follow. Patient safety measures. So you're reporting errors and analyzing. These are all very important to reduce the chances of error happening again. Medication safety, very important. Safety protocols should be followed. You'll have systems when they're disrupted because of any situation occurring. Very small situations, excuse me, could have big impact. So you should be always ready for these disruptions and reduce um, unsafe practices as much as possible. Workforce development, very important. Training your staff is very important. Mental health support to staff or to obviously social care workers. They're going to go through stress and burnout. How are you going to have that mental health support in place for them? This should be an integral part of your work culture. Cultural competency, so cultural training. So because the patients who you have to deal with or the clients that you have to deal with come from various backgrounds, so you have to have this cultural training of how to improve the use of and promote inclusivity, that you're including everyone and they're not being they're not being impacted by any status that they carry with themselves. Interpreter services, as I've said, very important, just to make them feel at home and make them more confident in you and your services. Access and equity. We've talked about health disparities that exist because of so many reasons. That shouldn't be there. Health inequalities or health inequities should not exist. These are, again, they stem from social determinants of health. And if you have an idea of what these are, you can advocate for reducing them as much as possible. Technology integration. We've talked about how important technology is, how important it is to use them in a meaningful way, because this is a resource that we cannot do without. So we have to have that also in mind. Ethical consideration. So you should have ethical committees because you have ethical dilemmas happening everywhere within an organization. So how do you deal with them? There should be a separate committee just dedicated for dealing with them. End of life planning, we've talked about this. Community engagement is very important, community partnerships. So if you're giving them um, uh, making them leaders and making them responsible for their health, it becomes very easy for you to carry out your work because it's giving making them responsible for their health, putting health in their own hands and for their community and for themselves. So it gives them an ownership and a feeling of partnership, which will be very effective in the longer run. Health education, as I said, very important. Health literacy and awareness is very important, considering that people have different myths, different backgrounds, different fears, and different expectations. Regulatory compliance, so you need to adhere to regulations. There should be continuous monitoring and accreditation systems should be there in order to make corrective action. So if you've not had that for a long time, you should then introduce this into your system. Feedback and continuous improvement. So feedback from patients, feedback from clients is very important. Feedback can be negative and positive. Always it should be you should bear in mind that it could be biased, but if there's a pattern that's being followed, you should then have go and have a better understanding, just analyze the data better to understand what the reasons are behind it. Quality improvement teams, there should be separate teams or multidisciplinary quality improvement teams as a part of your system. This is again working on different quality aspects of the system, and you have different people seeing quality or seeing the system through different lenses, so that helps a lot. You've kept multidisciplinary teams. Mental health support, we've said it should be there for the patients, for the staff. Disaster preparedness should be there, considering emergency plans. There should always be an A. If that A doesn't work, there should be B, C, or D, whatever is applicable in that situation. Research, so there should be a research committee again in order to disseminate useful research findings, and then whatever if you have newer findings that should be incorporated within your quality of care and treatments. Pilot programs, they should be run regularly. They don't require much resources and they can be done very easily before doing it in the larger population. So these give you innovative approaches and interventions to try on when you're testing them on smaller population before. So they're safe also. Transparency and accountability is very important. So the people should know that the systems are within your organization, they are transparent, and there's accountability at every level. And every healthcare and social care provider is accountable for delivering safe, effective, and high quality care to the best of abilities. Um, Legal and ethical oversight. So these are very important because you'll have these to protect patient rights and uphold ethical standards. Ethical committees, as I said, they should be there, and they should be there as a separate body to deal with ethical considerations. So if you implement these strategies on a continuous basis, you're then going to hope to improve your the quality of care that you provide to your patients and their service users. So these are all these references that you, if you want to look at them. So this is some more books if you want to read through them. And any queries, questions, or concerns, please email on this ID provided to you. Your submission of your assignment will be 2 weeks after today. So any questions, please let me know.
Yes, I have a question.
Yeah.
The question I asked last session about
Yeah,
the delivery
about
of
your
the presentation.
presentation.
Yes.
Yeah, your mode of presentation. Yeah, it's a weekend, so I'm hoping to raise this question tomorrow, if that's okay.
Yes.
Because obviously not everyone works on weekends. So is that okay? I'll just ask that in
That's okay.
from Sir Raman. Yeah,
Thank you. Yes, thank you.
yeah. You're most welcome. So any questions, please email here. But I'll get back to you on this bit on the assignment.
Where do I email you from? From my regular email, or do I have a Moodle email?
You can use your regular email it's okay. If you want to use your Moodle email, that's also okay, but just mention your name or your ID and I'll understand. So
Okay,
it
thank you.
actually goes to the system, yeah. So if I can't respond to it, there will be someone who definitely responds to your queries.
I see. Thank you very much.
That's okay. Have a nice day and good luck.
Yes, thank you.
Yeah,
Thank you very
you're
much.
welcome. Take care. Bye.